In 2009, I got injured at work, and that compiled with my chronic diabetes and other problems with my stomach from a condition called gastroparesis, which is a complication of diabetes. The problem that I had was the constant nausea and vomiting. Everybody knows that, when you vomit, it's stomach acid, and that acid will just eat the enamel off your teeth. And I would wake up every morning to a mouthful of vomit. It just deteriorated. And again, I let myself go. I was just too depressed to even get out of bed, let alone go take care of my teeth. Pretty much ended my career, and I had to apply for Social Security disability, which took, well, because I was so young, they kept denying it and denying it. And, for years, I didn't have any medical coverage. I didn't have any dental insurance. I didn't have anything. I wasn't able to work. I would try and go back to work, and I'd last a month or two. And then I'd go into a diabetic coma and be in the ICU for 3 weeks, and then have 7, 8 more weeks of recovery after that. No employer is going to put up with that. So finally, I got Medicare. I got the Social Security disability, and then I was eligible for Medicare, but Medicare doesn't cover dental. Being a diabetic with all the complications, I had so many, problems health-wise, and then I neglected my oral health. There's no other way around it, and it's like, okay, you got one problem and you got another problem, and you've got one thing that affects this, but this also affects it, and it's just like the revolving door. It's like, not only with the stomach condition that I have, gastroparesis, it makes eating difficult, but then not being able to chew food. And gastroparesis, what it is it's the stomach is not able to properly digest food. So not being able to chew food increased that so much and made it so much harder for my stomach to digest food because I wasn't able to chew it properly. And I'll tell you what, for the last year, for the first time in a long time, I was able to eat a steak, and I enjoyed it. One day, I was just so frustrated. I took a couple pictures of my mouth, and I wrote up my story, my history, my background. Before I was disabled, I was in law enforcement. I worked for the sheriff's department. And I basically told my story and what was wrong with me, and I sent the picture, and then I went online, and any dentist or dental office or anything that had to do with dentists that I could find in the Jacksonville area, I just emailed them my photos and my story. I fully expected that they were just going to pull all my teeth and give me a set of dentures and say, have a nice day. 11 crowns, I think it was 14 fillings, a bridge, dentures, everything later. I've got my mouth back. I've got a smile. I've got a smile. I notice I'm smiling a lot more. I notice that, I'm going out with my friends more. I'm going to visit family more. I'm going to my son's football games. Stuff that I never wanted to do before. I am planning on going back to work the first of the year, part-time, just to see how it goes. Last week, I finally was able to buy a car, so I'm back to driving now. I haven't driven in probably 5 years.